Hi everyone. Now we're going to discuss a case study with which is autism with ADHD. So socio-demographical details. Initial SK, gender is male, he is 8.5 years old, student in nuclear family. His chief complaints hyperactive, excessive energy and constant movement, short attention span, struggles to focus on any single activity for more than few seconds. And his sensory issues shows a strong preference for physical touch, giving hugs, and physical contact. Demonstrates sensitivity to loud noise. Behavioral instability, experience drastic and rapid change in behavior, such as sudden outbursts of aggression or irritability. Communication challenges, produce minimum speech, engaging in various activity. Partly eye contact with the instructor and others. So precipitating factors, environmental stimuli, in that distress and discomfort are frequently brought on by sensitivity to loud noise. Aggressive outbursts and violent behavior are a result of signals or circumstances that suggest punishment. Social interaction, poor obedience and attentiveness arise from a lack of loud and clear direction. Behavioral instability may result from adjustment to the surrounding or to social factor. So, in physical contact, if dissatisfied, a strong desire for physical touch may be a sign of underlying sensory problem and may worsen restlessness and hyperactive. So, mode on of onset, although the sustained age or duration of these symptoms beginning is not stated, the behaviors listed point to a recurrent pattern that is in line with early childhood onset. The child's symptoms most likely become clear when they participate in more structured activity that demanded constant attention and social engagement. So the course period, the symptoms seems to be persistent and chronic, affecting day-to-day activity. Biological function in that appetite had a normal appetite with a good diet. Energy is hyperenergetic for most of the time. So past illness, there is no mention of any specific past illness. Family history, there is no mention of family history. Mental status examination. Gentle appearance, posture, normal eye contact, normal attitude towards instructor, not cooperative, motor activity, hyperactive. Speech, intensity is moderate, tone of the voice not monotonous, gold directive, no, did not speak what was being asked for. Mood and affect, varied accordingly, judgment, poor judgment, insight, poor. Overall observation, hyperactivity, in excessive amount of energy and movement, difficulty staying still or seated, restlessness, especially during shorter period. Attention span, inability to concentrate on a task for longer than 10 seconds is known as attention span. Significantly short focus occurs at the activity is still well understood. Sensitivity and preference for sensation, that is gives physical contact, hugs are preferred over finger touches, responsible to louder noise, rarely look at the teacher, instead making partly eye contact. Behavioral change, severe behavioral change has occurred, manifest and regular violent outburst, often in response to cues that one is being disciplined. Humming sound, depending on the child's emotional stage, humming noise can fluctuate in intensity and be used as self-smoothing technique or a coping mechanism for sensory overloaded. Overall, by the observable symptoms of child would fall under combined diagnosis of ADHD, attention deficit hyperactive disorder, and mildly autistic. Thank you.